So there is term called as selective photothermal. When there is beam of light, it gets absorbed by melanin pigment. So this selectively destroys. Which body areas are most commonly treated with LHR?
For women, it's the face, the underarms. For males, it's little.
Can people with hormonal conditions like PCOD or PCOS can benefit from LHR?
Oh, what makes in-clinic laser treatment safer or more effective than home-use devices?
The devices which we use at our clinics are.
Don't go for these home-based devices.
Yes.
What is the one tip before the first laser session that you give your patient?
Don't scrub, don't use any product.
I would say start now.
Yeah.
That was my tip. Hi, I'm Dr. Kunjan.
Hello, I'm Dr. Abhilasha.
Today we're going to shoot the second episode of Face
and Follicle Show. This is episode 2.
So in this episode we're talking about LHR, which is laser hair reduction. Hi Abhilasha.
Hello Kunjan. So I think I should start with question first.
Go for it.
So what is laser hair reduction according to you?
So laser hair reduction is basically it helps in reducing your hair.
Yeah.
How we define laser hair reduction is there is a reduction in the density, that is the number of the hair follicles that you have. The thickness of the hair reduces and the color of the hair becomes lighter and lighter with as the sessions keep progressing.
Yes, exactly. So that's what I was trying to say.
Yeah, so I think permanent hair reduction is a misleading term.
Yes.
Reduction is better suited, right?
Okay. Yeah, exactly.
Yeah. So moving on to the next question. How does laser technology target hair follicles and what's exactly happening under the skin during the process?
So there is term called as selective photothermal.
Right.
So what happens is when there is beam of light, it gets absorbed by melanin pigment which is present in hair shaft. So this selectively destroys the hair without damaging surrounding skin.
Yeah, so basically we are targeting the color of the hair, not the hair per se.
Yes. So that's the reason it doesn't work on very fine or light colored hair.
Correct.
Yeah.
Okay.
So my next question is which body areas are most commonly treated with LHR?
I think if you think about it, most of the body areas can be treated by LHR.
Yeah.
There is no absolute area which we say is a contraindication. Of course, most commonly for women, it's the face, the underarms, the bikini region, arms, legs. And for males, it's little different considering for males it is beard shaping and ears, their ears are concerned.
Yes.
Is a concern. And what else? Which other areas do we treat?
I guess you covered everything.
Okay.
Yeah.
So the next question is, how many sessions are typically required for visible and long-lasting results?
So usually we recommend 6 to 8 sessions with a gap of 6 to 8 weeks.
Yes.
And then depending on hormonal fluctuations and disturbances in case of females, we might need some few more sessions.
Yeah, which is very important to understand that we are never restricted. When we say 6 to 8, it's not a strict 6 to 8. You can go beyond, and if some patients are lucky, they even see results before 6 sessions also. Yeah.
Okay, so next question is LHR suitable for all skin types and all hair color?
Yes, so the newer devices are very, very safe for all skin types. Indian skin usually lies between the spectrum of skin type 3 to skin type 5, right? So all patients,
Okay, so I feel it works best on thicker and darker hair. And mostly fine hairs won't respond much.
Even white hairs won't respond. So if anybody wants to get an LHR, I think now is the time to start.
Yeah.
If you get white hair, then I'm sorry, it will not work on it.
Yes, absolutely.
Okay, so I think enough about introducing LHR.
Yeah.
I think we can bust some myths and misconceptions regarding laser hair reduction, right?
Yes.
Okay, so the first one is the laser treatment painful and how do you manage patient comfort?
See, in most of the cases, new devices have inbuilt cooling systems.
Right.
So it only can cause like little bit of warmth and tingling sensation and not frank pain.
Yeah, and I think body areas relatively are, you can say, quite bearable, manageable. And only I think maybe the upper lip, if you're being honest, is sometimes a little.
Depends on pain tolerance also.
Yeah. It's very patient to patient, very subjective. Right.
So Kunjan, we have got one query like, can people with hormonal conditions like PCOD or PCOS can benefit from LHR?
Oh, absolutely. I think LHR is, I would say, even more wonderful as a treatment for people with females, especially with hormonal imbalances. Because they struggle more, right? They struggle with thicker hair, they struggle with unwanted hair in unwanted areas.
Lowered confidence and
exactly. And now that we've spoken about LHR, we know the device works great on thick and black hair. So I think PCOD patients are ideal patients for
so they might need more session or more number of sessions, but definitely they're gonna get good results.
Absolutely, yes.
Okay, fine.
Okay, now this is one of like a very common question, we get it from everybody.
Okay.
Are there any skincare products or treatments to avoid before and after LHR? Basically, ma'am, what to do and what not to do.
Okay, so as you said, it's one of the most commonly asked questions.
Absolutely.
You should avoid scrubs or AHAs, BHAs that might irritate your skin. So better to avoid it before and after also. And just stick to basic skincare routine, which includes your moisturizer, lots of it, and sunscreen, obviously. Okay, so next question. How the skin typically looks like or how it feels immediately after the session of LHR?
Okay, so it looks a little red, right? Little red and little swollen, but it definitely subsides within a few hours.
Okay, so do we need to take any kind of precaution for that redness or it subsides on its own?
No, it subsides on its own. We always, again, suggest just a soothing moisturizer. That should be enough.
Okay.
Okay. Next question is, what makes in-clinic laser treatment safer or more effective than home-use devices?
Okay, regarding this, the devices which we use at our clinics are US FDA approved. We can set specific parameters. It's very safe, doesn't cause any kind of injuries or burn kind of thing. And yes, obviously our therapist or our staff is very much educated to do this kind of procedure.
And it is done under our supervision, right?
Yes. So it's always better to do it at clinic rather than doing at home.
And even if there is any sort of untoward events, it is very well manageable because the doctor or the dermatologist is around, which if done at home, then you don't have anybody to turn to.
And there is issue of hygiene or parameters or a trained person, like so many issues if you do it at home. So
please, if anybody is considering doing an LHR, don't go for these home-based devices. Always consult a good dermat and do it in the clinic.
It done in clinic only. Yes, so when patients start noticing visible result after doing session, because most of the patients ask us कि एक session हो गया, 2 session हो गया, growth कम नहीं हुई, then how to tackle this?
I think visible results are seen mostly after the second or the third session. The time that it takes for the hair to regrow keeps getting prolonged, and the number of hair reduces, the color reduces, like we mentioned earlier. So I think second session or third session is a good.
We can expect.
We can expect results from them for sure.
Bottom line is, over period of time with number of sessions, it reduces. Becomes thinner,
the progress keeps happening over as the sessions keep advancing.
Understood.
Yes. Okay, I think this is my favorite question. Can LHR completely replace waxing or shaving?
So for most of people, yes, cause your growth again becomes finer, thinner, and like it becomes patchy. So after completing that required number of session, you hardly need any kind of procedures like shaving and all. And even if they do, the growth has reduced, so it doesn't.
Absolutely. And honestly, who wants to go to the salon again and again? Like that is such a pain point for females that we every month we have a function and we're like, oh, we have to go to the salon. So if you're regularly doing LHR sessions, I think you're very much sorted.
And I feel maintenance session is better than doing that shaving and waxing kind of thing. So
I think we've answered all the lengthy questions. Let's do a little fun, quick question round. What do you say?
Yes.
Okay. So you have to answer really quick. Okay.
Yeah.
First question is true or false? Laser hair reduction is only for women.
False. It works effectively for men also.
Yes. True or false? Laser works only on fair skin.
Not necessary. It's false. It works on all kind of skin types.
Yes. What is the one tip before the first laser session that you'd give your patient?
Don't scrub, don't use any active products before the session, and after session, moisturizer, sunscreen, that's it.
Okay. I would say start now.
Yeah.
That was my tip.
Okay, so my turn.
Yes.
The biggest myth you wish your patient should stop believing.
I think that that it gives a short-term result.
Okay.
Because once your hair is targeted, it's targeted for the rest of your
Yes,
life.
yes.
It's long-lasting results.
Or maybe it makes your hair grow back thicker.
Absolutely not.
Yeah.
It's
Okay.
going to make it thinner and thinner and thinner.
Yes.
Yes.
Okay, next question. What kind of result patient should expect realistically?
Realistically, anywhere from 80 to 90% hair reduction.
Okay,
Yes.
sounds good. Okay, so since we are discussing LHR, I had one case, one patient who has not got result despite doing 6 to 8 sessions of LHR. So in that case, like, what's your opinion? What should we do?
Okay. I think first of all, such patients should not feel disheartened. There are many patients who go through that. First and foremost, doing a hormonal workup in such patients is, I think,
Yes.
should be the first step. Also, once the hormonal workup is done, even getting an endocrinologist opinion in case there are hormonal disturbances, what should be the next step. And these patients might require few more sessions, even maintenance sessions more than the regular patients, but they will still get results.
Okay.
Yes. So Abhilasha, I think it was a lot of fun shooting today, right?
Yes, and I think we should shoot more episode.
Yes.
Yeah.
I hope the marketing team is listening
Yes.
to our and I'll see you soon.
Yes, okay, bye.
Bye.